Hello, it's me again, Emma Sylvester. Today we are talking sciatica. Sciatica nerve pain. I'll be honest, it is so common, but it is very painful. If you've ever had it before, then you will know what I'm talking about. There's many exercises out there, and you can also do the whole of the Pilates exercise routine, but you want something quick when you're in pain. So I've got two very simple exercises for sciatica to get quick, fast release. First one, you need a wall, okay? So simple. We've all got a wall. What I would say is if you're using a carpeted area or a mat, it would be better than a hard surface so you don't slip. We need grip on this. And when you're doing it, make sure you get close enough to the wall, but then not too close that you can't quite get into position. We want a right angle with the legs. So the feet are underneath the knees and then the knees are over the hips. And once you've found that position, legs are hip width apart. Relax down. Make sure the chin is away from that chest. Arms are nice and relaxed on the ground here. And then we're going to compress the back down into its pelvic tilt. We're going to push through the feet, making a little bit more effort to push into the heels. It's the push into the heels that really starts to trigger our glutes to fire up. So we're going to compress in, we're going to breathe in, we're going to breathe out, and we're going to push, and we're going to lift up. Now we don't have to lift that high. You might find just doing some small lifts here, but we are pushing into them heels and then we are lowering back down, vertebra by vertebra. Breathing in, breathing out, back down, push again, push down that wall, aim to push down, hold it, maybe hold a little bit longer if you need to feel it. I've had a few members before that have done this and they don't feel it initially, but after about 10 seconds, they start to feel it. The glutes start to load. Another little quick fix you can do if you're not feeling it in the bottom and you're getting it more in the back, go a little bit wider on your leg stance. Try that. And then again, push, hold it. Big breath out on the way up there. Keep breathing naturally for that hold. And eventually you will start to feel the glutes working. You'll get like a bit of a burning sensation at first. You might even feel that similar sciatic symptom when you're doing it. Any symptoms you get coming down, if that nerve pinches and you get this sudden sharp pain that can take your breath, it's quite scary when it happens. Just make sure you compress back down into your pelvic tilt. So as long as that back is back down, you will find it'll just switch off those nerves from reacting. It's when we relax the back and we start to breathe fast that starts to simulate the nerves. The other thing you can do is take the arms away. If you want to work a little bit harder, might have them across the chest or above the head. And then we just come up again. So this time we're not using the arms anymore. It's purely focusing on them glutes. And you're going to be doing it up to probably 10 reps of those, but it's all about getting those glutes fired up. The next one is using a ball. Now I'll be using the spiky ball. If you don't have a spiky ball, it doesn't matter. As long as it's a similar size, it's hard. Tennis balls are brilliant. I don't know, go and grab the dog's ball. Whatever you've got in the house, it'll work. So in this situation, what we are working on is the nerves more. Now, what a lot of people don't realize is the nerves have their own blood supply. It might sound a little bit strange, but when we're working on the nerves alone and changing that blood supply to the nerves, that's where we start to get into this system where the nerves do start to relax a little bit. So we're not doing anything to the muscles as such, but a lot of people can find that a little bit confusing sometimes. So rather than just sitting on the ball, which you've probably seen lots of these exercises across YouTube and things where we're sitting and we're finding painful points, which again are great. They are great for sciatica. But if we want to make it into more of a Pilates exercise and perhaps get a bit more benefit from a few more reps. So what we're going to do here is we're going to come down into lying neutral. And when you're doing this particular exercise, start off on your good side. I always advise good side first. You'll know why. You don't need the wall this time either. So this time what you're going to be doing is just making sure that you've got your knees bent, legs hip width apart, head block if you need it. And then we're going to be placing the ball underneath the painful, don't like to use the word pain, the tender area of the bottom. The best time to really think about where do I need this ball, just imagine you've got your pair of jeans on, you've got your back pocket of your trousers here, and you want to place that ball in the area of that back pocket. And I'll come back to back pockets later. And just relax, or try to relax. Now that's now going to be sticking into probably quite a painful point. Let it, okay? Then we're going to do a leg drop out. So we're going to breathe in, back grounded. We're going to breathe out, and we're just going to drop the right knee, if you've got the ball under the right buttock cheek, out to the side. And then you're going to slowly come back in. Breathing in, breathing out, work with it, dropping out. Now you're in control here. How low do you really want to go? So you can actually work with it. You could start off small. You can gradually get a little bit further with it. Sometimes in a lot of cases, the nerves fight it. So you might get like a bit of a twitch. The bum might start to twitch and feel a bit weird, like, don't like this. Let it do that. Let it take its time to relax. The more you relax, the more the nerve will relax, and the more you'll start to get that little bit deeper. And it's just stretching as well, that area. So it's just acting there as a neuromuscular technique. I don't expect you to remember that, but that is what we are doing here. Neuromuscular technique here, where we are just coming into that nerve, we're holding that pressure, we're changing that flow of that blood supply, and then coming off it, okay? So when you're doing those exercises, you can work 10 each side, then you'd obviously go over to your more painful side, give that a go. But big thing to really think about is the breathing. Keeping that breathing controlled, because the quicker your breathing starts to go, the more you're starting to feed that oxygen around the body. And we all know after time of doing that, things are going to get more painful. Calm the breathing, calm the body, and the nerves will also calm as well. Back pockets before you go. I have to leave you with this one. Mainly men, this is, just purely because of the types of clothes they probably wear, and we have our handbag where men will just stash everything into their pockets, keys, wallet, phone, everything is in the pocket. You're then going around your day, you're sitting down, even if you're not sitting down, it's pressing on the nerves. So empty those pockets out, get a man bag, whatever. You've got to think about what is going on day to day. It's not always just bad luck. Sometimes there's something causing it. If you're doing that and you've got your pockets full of stuff, get everything out. Make sure you're not risking anything pressing on any nerves. Okay, guys, thanks for today, and I'll see you again soon.